Well, Dr. Melnick, you told us in another interview that you're doing sedation dentistry. Can you shed a little bit light on really what that does, what advantages that has? Is it in any shape and form dangerous to the patient? Any side effects which maybe down the road, one doesn't really want? Tell us a little bit about it, because I know that not too many dentists are doing it. Would you please?
Sure. Glad to explain it in a little more detail. Well, there are literally millions of people that, for one reason or another, have developed fear of going to the dentist.
I wonder why.
And yeah. Well, you go listen to a stand-up comedian. All they have to do is say the words root canal, and people start laughing. So it's not unusual for people to avoid going to the dentist for many years, and it does have enormous health consequences that go beyond just their oral health. We have been both trained as hospital-trained dentists, so both Dr. Miles and I at one time have worked in the operating room and have done general anesthesia and IV sedation. But out in private practice, what we have found is that there is a technique involving oral sedation, where we literally give people pills that are crushed up. They either swallow them or we put it under their tongue and it's absorbed through the GI tract, and patients are put in a state of relaxation. They will be able to respond to requests like to open and to close, but patients will often fall asleep during the procedure. It is safe. It's extremely effective. And we work as a partner with the patients to get them comfortable. It works extremely well for patients who historically are difficult to numb, who have maybe a high gag reflex. The patients are, again, conscious, although may fall asleep during care. But one of the great advantages is the following day, one of the side effects of the medication is a property called retroamnesia. They will literally forget 90% of the treatment visit from the day before. And I can tell you from experience, patients love that. They don't want to remember the dental care, but we're able to get through an enormous amount of treatment in 1 or 2 dental visits. So we have been literally able to expand our practice, not only from the patient base that we're seeing, but we've expanded it to those patients who have been avoiding the dentist for 5 years or more. It's been a blessing for those patients.
So basically it's not just about, number one, you feel no pain, and time seems to be going faster. So basically, because when you don't have this sedation dentistry, there's only so long you can subject a person to sit in a dental chair, I assume, right?
That's correct.
But with this procedure,
absolutely,
he can sit 4 or 5 hours or whatever it might be, and he doesn't feel anxious. Because when you're sitting in a dental chair, I've never sat 4 or 5 hours, but you sit an hour even for a normal cleaning, which is usually rather heavy in my case. You start counting sheep, kind of, damn it, when is this going to be over? I have to open my mouth. And you're telling me that kind of doesn't happen with sedation dentistry.
That's correct. You absolutely lose track of time, but you are relaxed, you are comfortable. There are times that you'll fall asleep, sometimes you'll wake up, but at all times patients are extremely relaxed. So it's a very effective way to go. I've literally had patients, when we've had more than one treatment session, when we've asked them how to go the first time, they go, it's the only way to fly when you have dental care.
So you would go as far as your patients, actually, it looks like, going as far as saying time flies when you're having fun.
Well, absolutely. There are patients that we have, they wouldn't have dentistry any other way.
Wonderful. So, and the patient is still conscious that he can actually ask you questions or make a comment while you, let's just say, needs to go to the bathroom. I don't know. There's things actually still happening?
Yeah, patients will communicate with us to let us know if they do need a potty break. It's absolutely fine to do, and we wheel them over to the restroom, let them do their business, and bring them back, and we can start all over again.
Well, it looks to me like definitely a good thing, because who would want to go 4 or 5 times to a dentist to fix, let's say, whatever work has to be done, if you can actually do it in one time? Whatever cost is involved there, which I'm sure is there, but probably not super astronomical, is probably worth right there, not having to go, leave work or whatever it is for 2, 3, and 4 times and sit there and, well, as I said, open a mouth and count sheep. Sounds like a great thing to me. I can see why patients like it. And so you do say, there's no, other side effects after that, which, long-term side effects, something, nothing there.
Nothing long-term. Obviously, they need to have someone drive them to the office and drive them home. They take the rest of the day off and don't sign any legal papers or make any big decisions that day. But the following day, they can go back to work or do any full activity, and they're absolutely fine.
They're absolutely wonderful, and they forget even they were at the dentist. Do they forget the bill too, by the way?
Pardon me?
Do they forget the bill also with this treatment?
Do they forget the bill?
Yeah.
Well, we have third-party financing if they need help with paying off the treatment.
No, I was just saying, do they forget that they ever paid the bill and keep paying it twice? Maybe they say, "Oh, look, doc, I didn't pay you yet."
That no.
No, okay.
No, that's never happened. But we wouldn't take a double payment. That doesn't work. As they said, a whole lots of comedian out of a job, and I try to be funny. Well, Dr. Melnick, thanks for letting us know. I'm sure that's very informative to the people out there, knowing that there is actually something which gets them over their dental phobia, which to a very high degree, most of us have it. Even though dentistry doesn't work or doesn't hurt originally anymore, I've noticed that. I had a root canal maybe a year ago, and frankly, it didn't hurt anymore. But the point is, we still have this, this phenomena which we feel it is, this fear, and boy, if you can overcome it and sit there confident for a couple, 2, 3 hours, get a lots of work done, looks a great thing. Thanks a lot.